Hey everyone, I'm Dr. Rena, a urologist and pelvic surgeon. Today, we're going to talk about prostate gland enlargement, also known as BPH, benign prostatic hyperplasia. So what does that really mean, and why should it matter to you? BPH is a condition that's very common in men. In fact, among men over the age of 60, nearly 70% have BPH, and for those over 70, that number rises to almost 80%. So what actually happens? In men with BPH, the cells inside the prostate begin to grow and multiply. As these cells increase, they cluster together and form small lumps or nodules within the prostate. Now remember, the prostate is a walnut-shaped organ that surrounds the urinary tube and sits just below the bladder. As it enlarges, it can press on that tube and make it harder for urine to flow out of the bladder. In some men, this leads to symptoms known as bladder outlet obstruction. So what kind of symptoms are we talking about? Generally, they fall into two main groups: storage symptoms and voiding symptoms. In simpler terms, this means issues with the bladder itself or trouble emptying the bladder. When it comes to bladder-related symptoms, you might feel a sudden urge to urinate, like you need to go right away. You may also find yourself going more frequently, sometimes even having accidents if you can't reach the bathroom in time, or waking up during the night to urinate. On the other hand, problems with emptying the bladder can include things like waiting for your urine stream to begin, needing to strain or push, experiencing a stop-and-start flow, or having a weak stream with less force than usual. Now, if you have BPH, does that automatically mean you'll have symptoms? Not necessarily. Some men never notice any issues, while others may develop symptoms slowly over many years. You might even begin to see changes as early as your late 40s, and these symptoms can gradually worsen over time. So how can you tell if your urinary symptoms are due to BPH? The honest answer is, you can't be completely certain on your own. While BPH is the most common cause of these symptoms in men, other conditions like overactive bladder can cause similar problems. In some cases, it could even be an early sign of prostate cancer or another medical issue. However, if you've seen your primary care doctor or a urologist, and they've told you that your symptoms are due to an enlarged prostate, then there are generally three main ways to manage it. The first option is simply to monitor the situation, what we call watchful waiting, and see whether your symptoms get better, stay the same, or slowly change over time. The second approach is something known as conservative management, which involves a few practical lifestyle adjustments. Many of these are similar to what I've discussed in managing an overactive bladder, since avoiding certain triggers can also ease BPH symptoms. For example, paying attention to how much and what you drink, especially in the 2 hours before bedtime, can make a difference. It's also helpful to steer clear of bladder irritants like coffee, alcohol, and others I've covered in my bladder irritants discussion. You'll also want to be cautious with common cold and allergy medications, particularly antihistamines and decongestants, because they can sometimes make urinary symptoms worse. It's best to avoid them unless they're truly necessary. Another simple technique you can try is called double voiding. This means you urinate, try to empty your bladder fully, then stand up, sit back down, and try again. You don't want to strain or push, but repeating the motion can sometimes help release a bit more urine. Beyond these steps, there are also medical and surgical treatment options. So far, we've talked about observation and lifestyle changes. Now let's move on to medications. There are a few different types available, and the most commonly prescribed group is called alpha blockers. Medications like tamsulosin or terazosin fall into this category. They work by relaxing the smooth muscle around the prostate, helping urine flow more easily. That said, these medications can come with some mild side effects. The most common one is dizziness, which affects about 5 to 15% of patients. Another potential side effect is something called retrograde ejaculation. This means that during ejaculation, instead of semen coming out in the usual way, it may travel backward into the bladder. Finally, if you are planning to have cataract surgery, it's important to avoid these medications. They can make the procedure more technically difficult for the eye surgeon, so be sure to let your urologist or primary care doctor know if cataract surgery is scheduled. The second group of medications is called phosphodiesterase type 5 inhibitors. These are commonly used for conditions like erectile dysfunction, but a low daily dose of tadalafil, about 5 milligrams, has also been shown to improve urinary symptoms. This medication is taken once a day at that dose. Side effects are quite uncommon, but when they do occur, they may include headaches, flushing, mild stomach discomfort, back pain, or muscle aches. The final category of medications is known as 5-alpha reductase inhibitors. These include drugs like Proscar, finasteride, or dutasteride. What these medications do is actually prevent the prostate from continuing to grow, and in some cases, they can even shrink it. There are a couple of important things to keep in mind. First, they take time, usually about 6 to 12 months, to show their full effect, so you shouldn't expect immediate symptom relief. Second, they can come with some sexual side effects, such as reduced libido, lower sex drive, and occasionally symptoms of depression or changes in ejaculation. Many of you may have heard about an herbal option called saw palmetto. This supplement comes from the berries of a plant known as Serenoa repens, also called the dwarf palm. It's believed to work by blocking the enzyme 5-alpha reductase, which reduces the conversion of testosterone into dihydrotestosterone, a hormone linked to prostate growth. It may also offer some anti-inflammatory benefits. That said, based on multiple studies, current guidelines from the American Urological Association do not recommend it as a standard treatment. However, in my experience, some patients do find relief with it, especially those who cannot tolerate prescription medications. It tends to be safe and has very few side effects, so it can be a reasonable option to try. Now, the final treatment approach is surgical. There are several reasons someone might consider surgery. One is simply a preference to avoid taking medications. Another is if medications haven't worked well, cause side effects, or symptoms remain bothersome. Surgery may also be recommended if you're experiencing repeated urinary tract infections, which can happen when the bladder isn't emptying completely. Similarly, recurrent bladder stones can develop for the same reason, and that's another indication for surgery. If you're having repeated bleeding from the prostate into the bladder, that's another situation where surgery may be needed. And in rare cases, when the prostate becomes very large, it can block the bladder so severely that urine backs up into the ureters, the tubes that carry urine from the kidneys, and eventually into the kidneys themselves. This can reduce kidney function and lead to a condition called bilateral hydronephrosis. So, if this situation occurs along with an enlarged prostate, surgery is usually necessary to help protect your kidneys. When you start considering surgery, you and your urologist will base the decision on 3 main factors. First is the size of your prostate. Second is the potential risk of bleeding during the procedure. And third is your sexual function, especially how concerned you are about side effects like retrograde ejaculation, which can happen with many prostate surgeries. Now, let's briefly go over the surgical options. One of the first things to consider is whether the procedure will be done in an operating room or in an outpatient surgery center, and what that means for you. For many of my patients, we talk through these choices based on their personal preferences. If someone is eligible for an outpatient procedure, it can be appealing because it often avoids the need for anesthesia and the preoperative testing that comes with it. For some people, that alone makes things much simpler. Others may prefer this route because they're concerned about sexual side effects, and in those cases, outpatient procedures can sometimes be a better fit. These options include something called a prostatic urethral lift, also known as urolift. This procedure uses small sutures to gently lift and hold the prostate tissue out of the way, allowing urine to pass more easily. Another option is water vapor therapy of the prostate, commonly known as Resume. In this procedure, steam is used to break down excess prostate tissue. Both of these treatments are typically done in an office or outpatient setting without general anesthesia. One of the advantages is that these are relatively quick procedures. Most patients will need a catheter for a short time afterward, but overall, they have strong success rates and low chances of needing another procedure later. When we talk about reintervention, we mean needing an additional surgery because the results weren't satisfactory. For these procedures, the rate over about 5 years is usually between 2 and 6%. They tend to work best for smaller prostates, generally those under 80 grams. For larger prostates, we usually look at procedures done in the operating room. These include laser vaporization of the prostate, transurethral resection of the prostate, and aquablation. Each of these uses a different technique, such as laser energy, an electrical cutting loop, or high-pressure water, to remove or destroy excess prostate tissue. All of these procedures require a catheter afterward, and depending on your surgeon's approach, you may or may not need to stay overnight in the hospital. There's also a procedure called holmium laser enucleation of the prostate, which isn't available everywhere, but is very effective when performed by an experienced surgeon. This method not only breaks down the tissue, but actually removes the enlarged prostate tissue more completely, making it a great option for very large prostates. Before moving forward with surgery, there are a few important questions you should ask your doctor. First, how long will it take before your symptoms improve? In many cases, it can take up to 3 months to notice significant relief, even after surgery. Second, how long will you need to have a catheter? Third, will you need to stay overnight in the hospital? Fourth, what is your risk of sexual side effects, including changes in ejaculation or erectile function? And finally, what are the chances you might need another procedure in the future? Make sure you ask these questions, stay well informed, and choose a urologist you trust and feel comfortable with. I hope this information helps. If you have any questions, feel free to leave them in the comments below. And as always, take good care of yourself, because you truly deserve it.